Okay, so we've got a painful lesion on the end of a second toe. So it looks like there's been some tissue breakdown and probably even some bleeding underneath here. So we're a little bit suspicious there might be, hopefully not an ulceration under here, because you can get tissue breakdown and ulceration if we have too much pressure. So we call it a pressure ulcer. But what we do is, carefully go in here. It looks like we're being pretty rough, but it's actually quite hard. So we need to cut through this. So of course we're using a single-use Swan Morton 15 blade here. So they're single use, so there's nothing sharper. So we just have to keep chipping away with this until we get through the overlying callus. Then we start to slow down a little bit when we can see we're getting to like the area where there's viable tissue. So we keep going through that, and you can see there's right in that central section where there's a little bit of an ulceration, a little bit of softness, a little bit of moistness in there. So we go and remove all of that, and then we see what we're left with. And this one's actually looking a lot better than what we thought at the start when we started filming this. So it's actually looking quite good. So we should be able to clean this one up, just remove all the callus, and then we'll probably dress this one up just out of a precaution, but it's probably not overly necessary unless we break the skin here. So the treatment for this is basically trying to remove the apex pressure on the tip of the toe. So we go and remove all of that, and then have a look at the patient's shoes, maybe make a toe prop, which is like a little cylinder that sits behind the toes and takes the pressure in the joints of the toe rather than right on the tip. And obviously keep that toenail cut nice and short. So regular treatment for this one, we'll see how it responds over the next sort of 6 weeks, and then we'll probably do this 4 to 6 weekly, and then extend that out as it improves, and we can hopefully make some changes with the footwear and the toe prop.